All right, good morning. My name is Samuel Souto. I'm a student physical therapist from Dominican College, and today I will be presenting on the topic Sundowning in Dementia, the clinical relevance, pathophysiology, and the therapeutic approaches that we can implement in order to reduce or even experience a remission of sundowning symptoms. So, what is sundowning? Sundowning is the emergence or worsening of NPS, which stands for neuropsychiatric symptoms. Typically, these symptoms are seen in the late afternoon or early evening when the sun is beginning to set. These behaviors may consist of a wide variety of symptoms, such as anxiety, agitation, aggression, pacing, wandering, screaming, yelling, and even visual and auditory hallucinations. So, hearing things and seeing things that aren't actually there. These are very common behaviors in the nursing home that we've all experienced and we've seen on a day to day basis. And it's something that can be very taxing on not only the patient and the patients around that particular patient, but also the caretakers. So, about 93% of nursing home residents and 42% of assisted living residents display some kind of dementia related aggression. So aggression could be screaming, it could be physical, it could be verbal, it could be throwing of objects. And in most cases, this occurrence of sundowning is established through direct observation of the patient. So it's not something that you need, further testing for. It's just something that you can observe from the patient themselves or interviewing the caregiver because the caregiver spends the most time with that patient and knows them best. So they're going to know their tendencies. So sundowning is observed to represent the second most common type of disruptive behavior here, and it's frequently described as endemic in nursing homes, as well as wandering. So what causes sundowning? So there are many different types of causes, such as the physiological changes in the brain. We also have the use of a polypharmacy effect, which is utilizing multiple medications at once. There are also physiological factors like fatigue, hunger, certain medical factors like pain and sleep disorders, and environmental factors. The main one here being lack of exposure to appropriate amounts of light. So the ones that I want to focus here are three. The first one is going to be the degeneration of the suprachiasmatic nucleus. So the suprachiasmatic nucleus, or the SCN, is a structure located in the hypothalamus, and its job is to regulate our circadian rhythms by receiving appropriate amount of light from the environment from the retina. So whenever we look at light, that light shines to our retina, which is the back of the eye, and those receptors are going to send signals to the suprachiasmatic nucleus. What happens is that with the natural process of aging, there's actually a hypofunction occurring at the SCN. So there's a degeneration of that structure, specifically over the age of 80. So this is strongly correlated with sundowning episodes. Furthermore, we have unmet physical or psychological needs. So there's an abundance of research now showing that lack of aerobic exercise, physical exercise, or any kind of exercise is correlated with increased episodes of sundowning, which I will get into a little bit later. You also have exposure to inadequate amount of light. So not getting enough light is going to decrease the amount of the function of the suprachiasmatic nucleus. So melatonin has been used as a treatment for sundowning, and the evidence shows that there's a good amount of evidence showing its use. However, the Alzheimer's Association makes this recommendation. If you find it necessary to use sleep medications such as melatonin, discontinue them after a regular sleep pattern has been reestablished. So the reason is because a lot of patients who experience sundowning are already taking multiple medications. And we don't want to give them even more medications. So it's recommended to use melatonin for sundowning. However, once that sleep cycle is normalized, we should discontinue it and use other treatments such as light therapy. Here are some of the studies showing the effectiveness of melatonin on sundowning. So as you can see, there are various levels of dosages used. In this study by Faustine et al., it showed that just using 3 milligrams a day for 21 days showed a significant decrease of sundowning agitation in 70% of those patients. You also have dosages like 9 milligrams a day for 22 to 35 months. And interestingly enough, this study was done on 14 patients with Alzheimer's, and there was a remission of sundowning in 12 patients. So almost all of these patients had a complete disappearance of their sundowning episodes. So moving on to light therapy. Light therapy is an individually tailored, non-pharmacological approach, and it is recommended by the researchers to be considered as the first line of therapy for sundowning. So what light therapy really is just exposure to appropriate amounts of luminous light. So light therapy has been used for hundreds and hundreds of years. It's been used to treat certain mental health disorders like depression, where practitioners would put patients on a rooftop and just have them experience the sun. Just be there for minutes to hours and just soak up the sun. And that was one of the treatments for depression. Research has evolved since then to more targeted approaches, different types of light intensities, but really what light therapy is that exposure to light, simple enough, and it has been observed to produce a significant reduction of sundowning episodes. It's also been shown to improve agitated behaviors in elderly individuals who are institutionalized. So some of the research on light therapy shows that there's an improvement in agitation just within 2 weeks. Now these patients received light therapy from 10 o'clock to 12 o'clock in the morning at 10,000 lux, which is the intensity of light. And yeah, it showed improvements in agitation just 2 weeks, so it's pretty significant. Scurvy and colleagues administered a bright light regimen of a little bit less than 10,000, so about 5,000 to 8,000 lux for 45 minutes a day. And this resulted in significant improvements in agitation and the behavior pathology and Alzheimer's disease rating scale, also known as the BEHAVE-AD. So studies have shown that 30 minutes exposure to light, 10,000 lux of the cornea, again, improved agitation. So the main thing here is agitation. All these studies are showing that light therapy decreases agitation. And interestingly enough, the effects of light therapy were also shown in those with vascular dementia, which is the second most common type of dementia. So not only does light therapy help with Alzheimer's related dementia, but it also helps with vascular dementia. So here are a couple of products from the Best Alzheimer's Products website. Now I have no affiliation to these products. I'm not trying to sell anything. This is purely for informational purposes. And so the image on the left is of a device called the Bliss. And not only does it expose a patient to that light therapy, which can help decrease the sundowning, but it's also an area where they can keep their belongings in a safe way. So, one of the things in the nursing homes that as physical therapists, we try to prevent are falls. And if a patient can have all their belongings in one place and can actually see it, like use it as a night light, not only is it you're getting that light therapy effect, but you're keeping all your belongings in one place in a safe manner. So the image on the right is actually another form of light therapy, and it can be used for multiple patients at once. And what's interesting about this is that it has a negative ionizer, so it releases certain particles that are found in nature, like rainforests and waterfalls. So going to the bread and butter of the presentation, as physical therapists, we always promote exercise. Not only does it help with mobility, balance. Not only does it help prevent falls, but this research study is showing the effectiveness of exercise on cortisol levels in relation to Sundowning syndrome symptoms. So this was a study done on 80 patients with Alzheimer's. And the purpose of the study was to see if aerobic exercise, aerobic meaning walking, cardio, that kind of thing. So they wanted to see if aerobic exercise was effective in reducing sundowning symptoms. Now, researchers theorized that decreasing cortisol would help decrease sundowning. And the treatments were administered for 3 months, which is typically how long we keep patients for on program at the nursing home, 12 weeks. And treatments were done 1 hour before sunset. So strategically done 1 hour before sunset. After interventions, salivary cortisol levels were reduced by 26%. You've also had decreases in agitation and neuropsychiatric inventory decreased by 50%. So there was decreases in delusions, hallucinations, anxiety, agitation, and this is all significantly correlated with the reduction in the cortisol levels. So I just want to mention again, cortisol is a stress hormone that is made in the kidneys, and it is heightened in patients with sundowning symptoms because they're in a state of stress, right? So exercise has helped to decrease that, which in turn has shown to decrease sundowning symptoms. So in summary, these results indicate that exercise is good for these patients with sundowning, and they believe that there's a relationship between the HPA axis, which is a connection between the kidney and the brain, cortisol, and now sundowning. So what can we do? What are some of the treatments to summarize? So here's a little bit of a summary slide, and I actually have the addition of a few other treatment approaches. So the first thing is to keep things simple, maintain a daily routine. The patient should be comfortable with their daily routine. They should anticipate what's coming next. They should know when their breakfast is, lunch, dinner, exercise time, TV time, things like that. A consistent sleeping schedule should be maintained. So this consists of discouraging overnapping during the day. Caffeine, which is a brain stimulant, should be limited at nighttime. Using the sounds of nature, such as the sound of waves, has actually been shown to decrease sundowning as well. So we've talked about melatonin, how it's helpful. Exposure to bright light during the day may help ease sundown syndrome. And last but not least, physical activity should always be encouraged as it is a treatment for not only Alzheimer's, but also sundowning. So 5 key points. These are the take-home points I want you guys to remember from the presentation. I want you to remember that there is an actual physiological cause to sundowning syndrome. There are actual changes in the brain. There's degeneration that happens in that structure that we spoke about, the suprachiasmatic nucleus. Understanding this can help to increase empathy with the residents. We spoke about bright light. Exposure to bright light in the late morning helps decrease agitation and sundowning episodes. Even if you don't have these products, just going outside and getting some sunlight is very helpful for patients. It's important to maintain a daily routine. Overnapping should be discouraged, and physical activity should be encouraged by the entire care team. Thank you.